For this assignment, we chose the infant age group and to focus on breastfeeding. The members of our group are Colleen Murphy, Chanel Carbino, and Michelle Dezizek. By the end of this presentation, the learner will be able to identify common concerns related to breastfeeding, ways to assess for a successful latch, different types of positioning, and identify ways to assess for adequate nutrition. The learner will also be able to assess for complications and actions required to overcome the complications. Current statistics. By the third trimester of pregnancy, most women will have decided whether or not they will breastfeed. Education programs are the most effective intervention to promote the beginning of breastfeeding. The Centers for Disease Control report that only 73.8% of women who are able to breastfeed will attempt to do it. Current recommendations. The accepted recommendation is that babies should be breastfed for at least the first year of life. By 6 months of age, only 11.3% of babies are being breastfed exclusively. Breastfeeding versus formula. Infants who are fed with formula alone have increased occurrences of diarrhea, otitis media, urinary and respiratory tract infections, and bacterial infections. In the U.S., infants who are only formula fed have an increased mortality rate of 21%. In the past, a significantly high number of infant deaths have been associated with diarrhea infections caused by artificial breast milk. Breastfeeding is one of the best predictors of the survival of infants.
Education is a key component to ensuring successful breastfeeding. To plan for the education of breastfeeding, you can ask the expectant mother to tell you what she has heard about breastfeeding and discover how the woman feels about breastfeeding, what are her reservations, and what learning needs does she have. Because women will have made their decision about infant feeding by delivery, teaching and assessment should occur during the early prenatal visits. The assessment and learning needs and addressing women's concerns early on can increase the chance that she will choose to breastfeed. To encourage successful latching on, the baby should be in a quiet and alert state. You can educate the mother to look for the following cues that exhibit hunger: increased alertness, light agitation, turning, moving extremities, mouthing, and rooting. It is important to realize that crying is a late sign of hunger, and extended periods of upset may cause latching on to be unsuccessful. Mothers should be relaxed. Encourage the mother to breathe and make sure she is not raising her shoulders due to the stress of the feeding. Babies can sense the tension and will become tense themselves and can become completely disinterested in feeding if this occurs. Be supportive and remind mom to breathe and stay relaxed, and continue to remind her throughout the feeding session. Be sure to provide for privacy and pillows for comfort. Before beginning, mothers should wash their hands. Determine comfortable positioning. Educate mother to use the C hold far back on the nipple. Stimulate the baby's mouth with nipple to encourage them to open their mouths. If the mouth is not open wide enough, it can result in inadequate emptying and mechanical trauma to the nipple. Encourage the mother to gently slide the nipple into the baby's mouth and have the baby latch on. How to know if the baby has latched successfully. Feeding should not be painful. There should be rapid sucking followed by rhythmic sucks and short pauses. There should be no smacking sounds, and the mother should seem to be relaxed and breast feel softer. Mother may have some discomfort in the first minute of attachment, and if discomfort continues, educate the mother to break the seal and relatch. Mothers need continued support and validation for breastfeeding success. If latch is painful, encourage the mother to disengage and reattach. Flat nipples can be rolled to help with elongation, and reverse pressure may be applied to swollen nipples. It can be helpful to express colostrum and drip it into the baby's mouth to engage the baby. It is important to place the baby a little bit below the breast, as postnatal breasts are heavy and gravity can work against achieving a successful latch. The bottom of the areola should be drawn into the mouth as opposed to the top of the areola. The chin and the tip of the baby's nose should be touching the breast, and the nostril should be visible. Many mothers worry about the baby not being able to breathe, so you can reassure her that if the nostrils are visible, they can breathe. Infant lips should not be rolled in, but resting on the sides of the breast to create a good vacuum and avoid creating nipple soreness and trauma. There are 3 common positions to hold: the football hold, the side-lying hold, and the reverse cradle of crossover position. They are pictured on the right-hand side of the screen. Women will develop their own positions over time, as long as the baby does not have to stretch their neck in an awkward or have their neck in an awkward angle. Any position that allows for successful latch and promotes feeding is fine. There are many different ways to determine if the infant is drinking enough breast milk, as this is one of the biggest concerns of mothers. can use the amount of time breastfeeding, the amount of weight gain or loss, and the amount of wet diapers or bowel movements per day. Newborns should be feeding no less than every 3 hours, approximately 10 to 12 times a day. Should allow 10 to 15 minutes on each breast. A decrease in weight of more than 8% necessitates follow-up within 48 hours. A loss of more than 10% of birth weight warrants careful assessment of other causes and consideration of admission to the hospital. Nurses should remember that neonates normally lose about 10% of their birth weight by 3 to 4 days of age due to loss of extracellular fluid and meconium, as well as limited fluid intake. The birth weight is usually regained by the 10th to 14th day. The previous measurements are for after normal birth weight has returned. Another way to determine how much the baby is drinking is, if it's possible, weigh the infant without a diaper or with a dry diaper before breastfeeding. After a successful session, re-weigh the infant in the same manner as before to see exactly how much breast milk the infant is receiving. For the first 1 to 2 days, there should only be 1 to 2 wet diapers because the infant is mostly drinking thick colostrum. On the 3rd or 4th day, when the mother's milk comes in, the infant should start having 5 to 6 disposable wet diapers a day or 6 to 8 cloth diapers wet a day. Neonates may have at least 2 to 5 bowel movements every 24 hours for the first several months, and at 6 weeks old, some infants will switch from less frequent but larger bowel movements. There are many things you can do if breastfeeding is unsuccessful. You can encourage the parent to contact their local lactation consultant or La Leche League. They can determine if the latch is correct and help troubleshoot other problems. The local chapter here is located in Westchester. The information is listed below. You can also go online to www.lilli.org to search for other chapters of La Leche League. If the infant is not latching on but the parent still wants breast milk as the primary nutrition, encourage pumping. Pumps can be rented or bought. They can be rented from the local hospital, the La Leche League chapter, or from WIC. When you pump your breast milk, you have to store it. Breast milk can be left at room temperature for about 8 hours and refrigerated for up to 7 days, or be stored in a refrigerator freezer for 3 to 4 months, or a separate freezer chest for up to 1 year. After thawed and gradually warmed in a container of water, breast milk should be used within 24 hours and then discarded. Breast milk should not be microwaved because uneven heating is not only unsafe, but it may denature essential proteins, detracting from the milk's beneficial health effects. Another alternative to breast milk is formula. There are 4 traditional types of formula. There's cow's milk-based formula, which is the most traditional, soy-based formula, which is commonly used for children who are lactose or cow's milk protein intolerant, casein or whey hydrolysate formulas for children who do not tolerate or digest cow's milk formula or soy-based formula, or amino acid formulas.
Complications with breastfeeding. Infant thrush. Causes of infant thrush during breastfeeding is caused by the yeast Candida albicans, which thrives in warm, moist areas. This infection can be passed between the mother and the breastfeeding infant. It occurs most often during or after antibiotic therapies. Although it is not very common, the mother's nipples and infant's mouth make for an ideal situation for the infection. Description of symptoms. The symptoms in the mother include deep pink, tender nipples that are uncomfortable during or immediately after nursing. Symptoms in the infant include redness and white patches inside the baby's mouth and a diaper rash. They may want to suckle more often, and they may have a change in his or her mood. Infant thrush treatments. Treatment for the mother and baby include calling your healthcare provider so that you can obtain a prescription for an antifungal medication. To avoid in the future, make sure the mother is wiping her nipples before and after nursing, especially when on antibiotics. Mastitis is a breast infection, and the symptoms include muscle aches, fever, a red, hot, tender area on one breast, as noted in the picture to the right. Causes of mastitis occur most often in mothers who are stressed and exhausted, have cracked nipples, plugged milk ducts, or breast engorgement. They have been skipping feedings, or they wear a tight bra. How to treat the infection. Contact your healthcare provider immediately. They may prescribe antibiotics. Moist, warm compresses over the area help to soothe the infection, and rest is important to heal. Wear a comfortable bra between feedings, and continue to feed from the affected breast to promote healing. The breast milk is still safe for the baby. Prevention includes continuing to alternate feedings between breasts. If the nursing is too painful, pumping or manual expression of the milk is recommended to prevent any further infection. Clogged ducts. Symptoms include a lump felt close to the skin, redness, tenderness, and warmth in the area, and a small white spot may be seen in the opening of the duct in the nipple. Causes of clogged ducts include the baby may not be feeding well, the mother might be skipping feedings, which is common when weaning, and wearing a constricting bra. How to resolve clogged ducts includes massaging the breast and putting gentle pressure on the area to expel the plug from the duct. To avoid clogged ducts in the future, feed the infant regularly, wear a comfortable bra, or use manual expression and pumping. Cracked, dry, sore, or inverted nipples. Troubleshooting while feeding. Check the infant's positioning and encourage the baby to open wide when latching on. Offer the baby short, frequent feedings to encourage a less intense suck. Nurse on the least sore side first, if possible. Break the baby's suction from the breast by pulling the baby's chin down or pulling the corner of his or her mouth before removing from the breast. Causes of nipple soreness include poor feeding techniques, the wrong positioning, and not taking proper care of nipples. Treatments include applying warm, moist compresses to the nipples to soothe, only when yeast infections are not present. Also, you can apply fresh breast milk to the nipples to soothe and reduce the chance of infection because antibiotic properties are found in the human breast milk. This should also not be applied when yeast is present. If nipples are cracked or dry, apply moist medical grade lanolin ointment or a hydrogel dressing to encourage healing without scabbing or crusting. Folk remedies to avoid include applying moist tea bags because they have an astringent or drying effect and it is not recommended. Cabbage leaves have also been found to pass salmonella to the infant from dirty leaves. Products and alternatives if breastfeeding is difficult. Breast shells are available and are worn inside the breast to help and draw out the nipples by applying constant suction to draw them out. They can be applied a half an hour before nursing, but they are not recommended to be worn overnight because you cannot save the milk that is collected while wearing them. A breast pump is also an alternative, or the Evertit nipple enhancers. They're used before nursing, and they are a syringe with a soft, pliable tip that can be used to provide suction to help nipples protrude for easier latch-on. Nipple stimulation can be used by rolling the nipples between fingers and touching it with a cool, moist towel to help the nipple become erect. You then pull back on the breast tissue to help the nipple protrude. A nipple shield can be worn over the mother's own nipple. It is made of a thin, flexible silicone. There are also holes in the shield so that the baby can feed through it, and it can also help the baby learn how to latch on. Remember, there are resources available to help out if you're having trouble breastfeeding. Education is key to successful breastfeeding. If you could please take the survey listed below, that would really help us out. Thank you.